8 months ago, we implemented a new discharge protocol. Every patient gets a follow-up call within 48 hours. Patient satisfaction? Up 15%. Readmission rates? Unchanged. The patients like the call, but it's not preventing readmissions. Something is missing. I have 2 data sources: patient interview transcripts, 20 patient interviews about their discharge experience, and clinical outcomes, readmissions, length of stay, medication counts, risk scores, etc. The quantitative tells me who is being readmitted. The qualitative should tell me why. And my job is to figure out what. So let me quickly head to FableSenseAI.com and log into my account. Now create a new project to keep everything organized in one place. I am going to name it Discharge Protocol Study, and description: show medication confusion correlates to readmission. Click on Add Dataset button to upload your quantitative data. FableSense AI analyzes your dataset and give you a complete data preview. Now, let's upload all the qualitative documents. Click on Upload Document button and select the project we created earlier. I am going to upload all the interview documents at once. FableSense AI automatically performs thematic analysis on all the uploaded documents. It generates an AI summary by reading the document, an overall sentiment analysis, and extract themes with confidence scores. This gives me a head start before I jump to qualitative coding. Now let's navigate to the qualitative coding workspace. Click on the Open Coding Workspace button, select the project from the drop-down, and choose a document. Create new codes. I am going to create 4 codes with different colors. First, medication confusion in red. Second, device/inhaler confusion in orange. Third, clear instructions in green. And fourth, lives alone, no support in yellow. Let's code Marcus's interview. He had a heart failure management procedure, got discharged after 6 days of hospitalization, but was readmitted after 3 days. Why? Because he said, I ended up doubling up on something because I didn't realize the new one replaced an old one. Color code: medication confusion. Let's move to David's interview. He was also readmitted after 5 days of discharge. He said, I was doing it wrong for 3 days. I was just pressing it and breathing in quick, like a spray bottle. Color code: device inhaler confusion. Now let's see Sandra's interview. Here, on the contrary, Sandra was never readmitted. She had a knee surgery procedure and stayed for 2 days. As she was never readmitted, let's see what she has to say. She said, they gave me a clear schedule: 1 pill morning, 1 night, ice 20 minutes every 2 hours. Color code: clear instructions. Notice the pattern. Readmitted patients talk about confusion. Non-readmitted patients talk about clarity. The content of the discharge matters more than the call itself. I want to see each patient as a complete picture, not aggregated, individual. For that, I need to create a case-level analysis. I am going to give the display name Patient Discharge Profiles and select the dataset and all the interview transcripts. The case-level analysis allows me to take a closer look at an individual's qualitative as well as quantitative data side by side. Case 1, Marcus, a cardiac patient, 4 new medications. His quotes tell the story. He didn't know the new pill replaced an old one. He was taking both. Readmitted in 3 days. And his satisfaction score? 3.1 out of 5. But the call was completed. The call asked, how are you feeling? He said, fine. No one asked, walk me through your medications. Case 2, David. Respiratory problem, first-time inhaler user, lives alone, using it wrong for 3 days before readmission. Again, follow-up call completed. No one asked him to demonstrate his inhaler technique. Case 3, Sandra. 1 new medication. Simple schedule. Not readmitted. The pattern is right here. Complexity without support equals readmission. Simplicity with clarity equals success. I can also switch to the integrated view to see everything in one stream. Useful for clinical case reviews. Now let's confirm this pattern across all 20 patients. I am creating an integration matrix joint display. The integration matrix helps to analyze relationships among qualitative and quantitative data. I will use AI analysis to map the relationships. Let's look at readmitted versus medication confusion. You can see the AI not only creates relationships, it also states a clear reason what this relationship actually means. Similarly, let's take a look at readmitted versus overall positive experience. It clearly states that readmission indicates a negative experience. Hence, it's a contradictory relationship. Based on this analysis, here's my recommendation. For patients with 3+ new medications, add pharmacist follow-up, not a nurse call, a pharmacist who can do medication reconciliation. For patients with new devices, inhalers, injections, require teach back before discharge. Watch them use it. Don't just hand them a device and assume. For patients who live alone, flag for earlier follow-up. They have no one to catch errors. The generic discharge call stays. It helps satisfaction, but high-risk patients need more than a call. This is how mixed methods improves patient care. The quantitative showed us who was being readmitted. The qualitative showed us why. The integration showed us where to intervene. The discharge call was helping the wrong patients. FableSense AI, research that improves outcomes. Try free at FableSenseAI.com.